Fentanyl is taking hold in southern Colorado. According to the Drug Enforcement Administration, in the last decade, fentanyl has gone from an obscure drug in the U.S. to the leading cause of death among adults between the ages of 18 and 45. Those who are closest to the crisis in our community say that they are seeing users' tolerance increase. Some who are taking up to 50 fentanyl pills a day. But as News 5 investigative reporter Megan Cloherty tells us, practitioners who are working with addicts to help them recover say that Medicaid is now limiting how much they can help.
Doctors tell us the average use of fentanyl in our community is changing. And one Colorado Springs practitioner who helps addicts recover is sounding the alarm. He says the amount of treatment now needed to help someone safely recover from fentanyl dependence is hard to get through Medicaid. A speck of fentanyl could kill you, but some users in Colorado Springs who've built up a tolerance are chasing a new high. Some taking up to 50 pills of fentanyl a day.
This drug has somehow managed to induce tolerances higher than we've ever seen.
Dr. Kevin Snyder opened Achieve Whole Recovery Clinic in 2017 to offer testing, support services, and outpatient treatment for Medicaid patients.
We were seeing people at 1 milligram and 2 milligrams was like, whoa, that's a lot. We were now having people come in and reporting using 4 to 5 milligrams of heroin. And we were like, how are you surviving? How are you still breathing?
To get an idea of how it's affecting our community, according to 2023 data from the El Paso County Coroner's Office, 84 people died from taking fentanyl out of the total 146 drug-related deaths that year. That's up from the 79 people killed by fentanyl in 2022, which overall had fewer drug-related deaths. As fentanyl is produced illegally and is uncontrolled, there's no telling how much is mixed into any drug or compound. The potency can vary, and that's why one pill can kill. But an increase in fentanyl tolerance among Snyder's patients means they're taking more and need a higher dose of medication to help them wean off the drug.
We kind of have a limit. Medicaid will only pay for 24 milligrams of buprenorphine per day. But we're afraid that the tolerances that fentanyl has produced is leading us to believe that maybe some of these people actually need more like 32 milligrams a day.
We checked with Colorado's Department of Health Care, which oversees the state's Medicaid program. It covers 24 milligrams of buprenorphine daily and will cover 32 milligrams for patients with prior authorization. But Snyder says Medicaid is not keeping up with the higher usage, and his clinic has to change how it treats patients.
And so the way we would treat it with the buprenorphine in office wasn't working anymore.
Instead of one shot in the office, clinicians now instruct patients how to self-medicate to continue treatment at home. Snyder says it's necessary to ward off withdrawal symptoms that could push them to relapse.
So we went from in-office inductions to primarily home inductions, which is basically, here's your medication, here's your education. Let's hope that you can do it correctly and make it through. So much more complicated.
Meanwhile, Colorado's justice system is also seeing the effect of higher fentanyl use.
They're seeking now specifically fentanyl out on the street, and they might use 40 or 50 pills in a day.
El Paso County's top prosecutor, Michael Allen, says investigators are starting to bring in cases that reflect the marked increase in the amount of fentanyl exchanged in drug deals.
We're probably going to see a lag when that starts to hit our doorstep with cases. But the number of cases that we've been filing from last year to this year has grown exponentially.
Allen says he's implementing state legislation as a tool to fight back against drug dealers by raising penalties they face if convicted. Under Colorado's Fentanyl Accountability and Prevention Act, passed in 2022, if someone is found in possession of more than 4 grams of fentanyl, the case is bumped up to a level 2 felony, which means they could face a max of 8 years in prison and fines of up to $750,000. New figures from the Drug Enforcement Administration show in controlled testing last year, 7 out of 10 fentanyl pills tested in a lab contained 2 milligrams, which is a lethal dose. That's up from 4 out of 10 street fentanyl tested in 2021. According to the DEA, last year, more than 112,000 people in our country lost their lives after taking fentanyl. In studio, Megan Cloherty, News 5 Investigates.